You have work, and then you have a mission. And for me, this is more mission than work. One of the young homeowners in the area, his 8-year-old daughter had stepped on a discarded, used syringe, and it had poked her in her foot. You know, fortunately, they were able to take her to the hospital. She got tested, everything was good. We started to realize the need to clean up syringes. My name's Bakaria Tiba. I'm the Director of Community Engagement here at Charm City Care Connections. Charm City Care Connection, we're a nonprofit organization. We initially was founded in 2009 by a group of medical students and community residents from Johns Hopkins. And the goal at that time was to connect people in the community who faced a lot of challenges and had a lot of barriers to receiving like primary care treatment, medical assistance. So we were trying to connect people to medical access and case management. Access to healthcare is good, but we got to start helping people navigate some of these other barriers that prevent them from having that access. Also, we started to realize that many of our clients and participants were actually suffering with like substance use disorder and opioid use disorder. And that's when we kind of made the hard shift into harm reduction. Charm City, we run a drop-in center right here at 1214 North Wolf Street. We open up at 9. We stop doing services at 4 o'clock Monday through Thursday. Clients and participants, they come into the door. India or somebody's usually at the front desk. They'll come in, they'll let them know what they need. Sometimes they just want breakfast or they just want lunch. This is our SSP room. This is where our actual supplies, where our clients actually come and get the supplies. This is everything that we give out in our kits. We try to make it as easy as possible and as simple as possible so that they'll know exactly what goes into each kit. This right here is our memorial wall. And we're on the front lines of fighting this opioid crisis. And in the process of that, we've lost people, you know, so we try to memorialize those that we lost. These are some of our clients, participants, and former staff that we've lost, you know, whether it's to overdose or other health-related issues.
Sorry about the rhetoric. No problem.
So when you think about harm reduction, you think about just meeting a person where they at, empowering them, giving them the support that they need, listening to what it is that they need, not determining what they need. So we try to go out in the community and make sure people have the resources that they actually need for those that, you know, are unable to access us in the building.
Oh man, today we're doing outreach. We're feeding the community, we're giving them supplies, we're taking care of them, showing them a little love, bringing Charm City to their area. I love it. It's good, you know, giving back to the people, showing love to the people, and just giving back to the community, man, and helping, you know, sometimes, man, people come and we put them in programs and things like that, and you can watch them change their lives and make a big transformation and do a big, you know, make a big impact in the city.
When I started here at Charm City Care Connection 4.5 years ago, we had a relatively small staff. You know, myself and maybe 4 or 5 other people were running the drop-in that you see now and doing the outreach, right? And just in a 2.5, 3 year period, we've expanded to like a staff of like 28. Many of the counties and principalities throughout the state have been hard hit by, you know, the opioid epidemic. Baltimore City is one of the hardest hit cities in the country. So the city opted to stand out of that because they didn't feel that the compensation they would receive from being a part of the state class action suit would really speak to the damage, the trauma, the hurt, the pain, and the resources that are needed to, you know, have a meaningful impact inside of Baltimore City. Charm City was actually the first community-based organization that was named to receive funds, you know, from the opioid restitution settlement case. We just finished our grant agreements and things of that nature, and we plan to take that money, improve and enhance the quality of the services that we're already doing, and we want to expand. I see Charm City being one, a bigger staple throughout the city and not just East Baltimore, but also being a model that other organizations can emulate and other cities across the country can emulate the work and the model that we've built here.